Barbells are not just used for squatting, deadlifting, and bent over rows. In fact, there's a lot of cool core exercises that you can do if all you have is a barbell. I wanna show you 5 of them, and on top of that, these are all great if you have chronic back pain, herniated disc, bulging discs, or even post-fusion, and you're looking to find a set of safe core exercises for you to at least start with and experiment with. You're not gonna wanna miss this video. Now, if you're looking for the best approach to back pain with core exercises, it's not just about grabbing a couple exercises and just doing them. There is a system, there's a strategy that I think you should be following and that I've seen a lot of success with when applied to a lot of the people that I work with one-on-one. I wanna give you a free guide that's gonna take you into the mind of me and how I look at core training, how I look at back pain, and how you should be structuring your workouts when it comes to your full body training with the core exercises that you're picking. I'm gonna talk about the reps, the sets, what exercises not to do, what exercises that you should do, and when you should do them in your program. Grab that free guide at fitnessforbackpain.com/core blueprint. So the first exercise is the standing loaded marches. We're gonna have a barbell, we're gonna load it. Here I have 2 10-pound weights on both sides. You don't need to go very heavy with this. The goal here is to keep your body in a neutral position. Oftentimes when we have weight overhead, we tend to kind of slam out into extension, and this is gonna help you train yourself to keep your ribs down, keep your hips engaged with the actual exercise, and keep yourself out of extension. Another key factor with this exercise is you wanna go very slow. It's easy to kind of start rushing it. Even you see a couple reps here where I start to sway side to side. You wanna make sure that you do not do that. Be very careful, go very slow. Think technique over just simply getting reps done, and this exercise will be awesome in your program. The next exercise is a modified flag. I'm using the same setup that I did with the exercise previous to this one. Key things to look for in this exercise is 1, your low back needs to be flat and pressing into the ground. Ribs are down, abs are engaged. I'm starting with my feet pointing towards the ceiling, and I'm slowly coming down. As soon as I get to a point where I feel my low back wants to start arching, or I'm losing that structure in my stomach and in my ribs and my core, I'm going to stop. Do not try to go all the way down to the ground, tap your heel, come back up. You will cause symptoms. So go to the point before your symptoms would typically kind of pick up, build tolerance there, and then gradually make it harder and harder as you work through the exercise. So this next exercise is kind of like a 2-for-1. I'm gonna start off with a basic loaded dead bug variation. I like to have the weight shift a little bit more over my head so I can really engage the trunk when doing this exercise. From there, I'm going to keep my low back nice and neutral and core braced as I do all the movement like a typical dead bug with my feet or below my waist. Go very easy. You can modify the leg movement based off of where you are and what symptoms might create when you're doing this, but it's a pretty safe exercise for you to try. From there, I make it a little bit harder. It's kind of like a ceiling press and a dead bug kind of have a baby and come up with this thing. And basically what it is I kind of do a semi-crunch ceiling press with a dead bug type of movement. So as I'm pressing the weight towards the ceiling, I'm also bringing my knee towards the barbell in like a little crunch or ceiling press fashion. So if you are flexion tolerant, as in flexing the spine at this level does not cause pain, I encourage you to try it. It's fun, it's challenging, and it'll really get your abs going. So this next exercise is what I call the Spartan Rollout. Yes, I said Spartan Rollouts. What you're gonna do is grab the same barbell and plate setup here, and I'm gonna get into kind of like a rollout position. If you are familiar with the ab wheel, then that's what I'm basically doing here just with the barbell. What I'm gonna do is as I'm rolling out, I'm gonna stop at the point where I feel safe, comfortable, and nice and braced, and I'm going to shift and roll that right or that left plate out as far as I can, and then I'm gonna bring it back. I'm gonna repeat both sides. 1 rep has 1 shift to the right and 1 shift to the left, and then you're gonna do as many reps and sets as you want. Be safe, be careful, stay within your pain threshold. So I pulled this last exercise from a very old video that I shot a couple years ago, but I wanted to include it in this video. And basically what it is it's one-sided or uneven barbell holds. And what you're gonna do is just load up one side of the barbell. The closer you are to the plate, the side that's loaded, the easier the hold is going to be. The further away from the plate you are, the harder the exercise is gonna be. So take that information, adjust accordingly, have fun. This is a really cool exercise. Core training is not just about picking the 3 best exercises for you and doing them. I think when you're taking core strength, endurance, stability, core coordination, you're trying to combine it to make an efficient program that is safe for post-surgery or herniated discs, or for, in my case, a ruptured disc. You have to go about core training strategically, and I want you to be smarter than maybe you came into this video when it comes to core training. So I want to give you a free guide. You can go to fitnessforbackpain.com/core blueprint. I'm gonna give you all the information you need to apply core exercise to your unique, specific situation, how to answer some very important questions as it pertains to picking the right exercise, and then actually executing those exercises in your routine. Grab that at fitnessforbackpain.com/core blueprint.